everyone. This is your host, Dr. Tommy Mitchell from the Mental Health and Wellness Show. Today, I have the pleasure of introducing Estefana Johnson. She is a licensed clinical social worker and experienced trauma therapist with over 2 decades of experience in mental health. She began her career in 2001 as a behavioral health technician, briefly stepping away in 2005 to teach in Japan. Her diverse background spans multiple roles and settings, including residential treatment for at-risk youth and medical social work, giving her a well-rounded perspective on mental health care. As the director of clinical training for Arise Alliance Institute, Estefana Johnson oversees the professional development and training of clinicians on critical memory integration, CMI. Her role involves designing and implementing comprehensive training curricula for mental health professionals to enhance skills, particularly in trauma-focused care, PTSD treatment, and therapeutic interventions. Estefana also develops and delivers trauma-informed programming tailored to the needs of at-risk populations, bringing these services directly into community-based settings to ensure accessible, responsive care when it's needed most. With no further ado, welcome to the show.
Thank you. I'm so excited to be here,
I'm
especially.
excited to, whenever I read the bios, I'm just like, yeah, bio, bio, bio. But I can't wait to get to our conversation because honestly, we were having a great conversation before. Is there anything you would like to share with our listeners so they can get a better, feel for you?
Yeah, I think more so than any career achievements or accolades or any of that, it's like I'm just a human being. I'm a minority. I'm first generation Mexican American. I've been through my own journey as, with generational trauma that was handed down and my own process of fighting the system or trying to like figure out my place in the system. So to me, I think that holds more weight and more um, of what shapes me as a social worker, as a human being, as like what drives my purpose. It's just way more important to me.
I agree with that, and I also can relate to that as I guess I am an immigrant. My parents, I left my native country as a baby and moved many different countries before I came to where I am. So, and obviously a visible minority and having gone through a lot of traumatic experiences in my life,
Yeah.
and I believe those experiences were the biggest teachers to me and have colored my world so many different colors. It's not like black and white.
Yes.
It's like a rainbow. It's like it
Yes.
was 3D next generation before I even knew what had words to describe it. It was something else. But I think because we've walked through certain paths, we can understand situations a lot more compared to somebody who perhaps had a very, straightforward path.
Yeah, and I tell people there's a lot of people with great hearts,
Hmm.
and I want to honor that, like the intention, but
Yes.
sometimes well-intentioned people without experience don't get it accurate, and that
Yes.
can cause harm.
100%. I agree. Sometimes well-intentioned people with lack of experience can cause harm. It's
Yeah,
just what it is, right? And that's why I really think it's really important to be whenever field one is to be authentic and
100%.
put it out there. Like, you know what? I don't, I may never have had this experience. However, this is what I feel. You know what I mean? Like, at least be a little more real. But, I also think there's some fields that you need to have experience in. I really do. I really think
Well,
experience matters.
I think any field. I mean, who would want to, when people say, well, your surgeon doesn't have to have, the condition to know how to do surgery. Well, no, but I don't want a surgeon who read 10,000 books. I want one who's done 10,000 surgeries. Like,
Yeah.
I don't care how many books you read. Have you done this? And what
Yeah.
is your survival rate? It's
Yeah.
about the practice,
Yeah.
it's
100%.
different. It's different. You can't, my example, I don't know, do you ever had Japanese food?
Mhm.
Like, so, do you know what okonomiyaki is?
No, I'm not
You never
familiar.
had okonomiyaki? Okay,
Mm-mm.
well, the new word, like, how many books would you need to read to understand what that tastes like, what the experience of it is?
You can't. You
You
can't.
just can't. You can
Mhm.
read all the books, you can get somewhat of an idea, but until you've savored it, until you've chewed it and digested it, it's
Mm.
really hard to really grasp
Mm-hmm.
like the fullness of that.
Mm-hmm.
And it doesn't mean that we don't that we have to go, I've never been you, you've never been me, right?
Exactly.
Like we all have individual experiences, but I've been to my cave, honey, and I came back. And I've been there many times. Like I've gone through the valley of the shadow of death. Like I've gone to the other
Oh,
side.
preach a
So
sister. Yeah.
if you have someone that refuses to go there or does everything to avoid it, how are you gonna help me?
Thank you. Exactly. And that is the truth. I agree. That we talk about empathy and sympathy and I want someone sympathy is nice, but someone who's actually been through it, I feel like they understand more or been through
Well,
similar.
compassion, yeah, and it's have you been broken to the place of brokenness?
Have
Have you
you
had
been
of your
broken?
pieces?
Yes.
Do you
Yes.
understand what that's like? Have you
Yes.
had to betray everything that you know for a world that you don't even, you're encountering into a new reality, and you don't
Yes.
even know if anything's guaranteed on the other side?
Yes.
Until you've been there and you've done that, how are you going to guide me through my transition, through my journey?
100%. And I agree. Like, and I love how you speak so true, like freely, and that's how I am too. I've realized that people who n don't have a sniff, they're often not the best guides. Or they maybe they have not only that, like we said off camera, you have to have owned your own life. Like you have to have,
Yeah.
you have to know
Mastered.
yourself,
Know
right?
yourself.
Deal
Yeah.
with your own issues because honestly in this profession we have the ability to do so much great work, but if we're not careful, so much harm, especially in mental health piece, because I find
Yeah.
that if the clinician, the physician, the whatever title we have, all these titles I can't keep up with them,
Yes.
whatever title we have, if we haven't done the aren't in the process of doing our work and done the foundational work, you're gonna have some blind spots. And that's why if you haven't done the work, perhaps the conversations that we may have in this podcast may be bothersome to you because you haven't done the work.
Yes. And that's okay, honey. Go watch
It's
Disney and come
okay.
back when you're ready.
Come
Like,
back where you're ready. Exactly. But it's a trigger is not a sign to just run away. It's a sign
an
that that's
invitation.
and but thank
It's an
girl. It's
invitation
an
to
invitation.
know yourself more fully, more deeply, more honestly, more authentically. Please
Person.
come to the table. Yeah.
Yes. That's girl.
Yes.
Sweet. Like it's an invitation, your body, your spirit, everything aligning. It's like come and sit with me.
Get
Those
to know
places,
yourself.
get to know yourself.
This is why I tell people, like, I know that we say do the work and it sounds so like, I tell people it's more work to not explore and understand yourself. It is so difficult
Yes,
to navigate through life trying to be something that you're not instead
exactly.
of embracing what you are and
Yes,
learning how to use that, right?
yes,
Learning what your purpose is. And I tell people you lose the real in search of the ideal. That
yes.
to me is the biggest, that is tragedy to me.
It
That's
it is. There is a lightness one has when you know yourself, when you've done the work and you continue to be aware of it because there's new stuff that happens every day. But the
oh,
difference
all the
between,
time.
right? The difference between the current 2.0 and the previous version is that this version is almost like the duck, where things that would bother them doesn't bother them. It's now it's like waterproof. Okay, yeah, you said something rude. Okay. You're not messing up my
That's
energy.
what we call integration. That's what we
Oh,
call
girl,
integration, right?
I'm just talking. You guys have terms for this. I love it. So that means we're not talking quackery because I'm all the way in Canada
No, no,
talking
no,
about
no.
this.
Oh, we have the modality. This is where it came from.
Yes.
I don't I used to do as a trauma therapist thinking, let's make it not hurt. Let's make it go away so you don't have these flashbacks. No,
Mm.
those are all signals that are begging you to come, inviting you to
Yeah.
understand something you have not digested and you have
Thank
not yet
you.
fostered, to get a piece of like wisdom, understanding,
Yes.
depth. uh it's such a loss. And I said when the previous modality I used to use was all about erasing things
I
and
know.
no more,
Yeah.
and I'm like, you're erasing yourself.
No.
Every time I erased, I was erasing a part of me. And there
Yeah.
was so much that was going with that. Learn to own it, learn to
Yeah.
master it.
It's
And
just
that's our mission right now.
I love it. It's not even in medicine when there's pain. Pain is a signal that your body's like, hey, there's something interrupting my homeostasis, something is going on. Please tend to me. It's not just numb it with medications. It's not let's just ignore it. No, what is it?
But you know why we do that, right?
Well, girl, I used to stick to Kool-Aid before, but now I've seen the light. We know,
I mean,
right?
there is some benefit. It's not to you, but
Yeah.
there's some benefit to be had.
Yeah, it's all it's again, that's another disaster called the healthcare system, right?
Yes.
It's designed to keep people in this chronic sick state. Everything is associated with
Yeah.
pain
I
and
can't
trauma.
I can't make money off of you if you're healthy.
Well, fortunately, where I live, I'm in Canada, just everywhere remind, even though people think I'm in America, I used to live in the US. You can still make money on healthy people. You just keep on seeing them and
But
following
you
up.
know that, well, that's the sad thing too. Not me. I'm like, I am not here. Like, if you are still around, I mean, there's people who come that have nobody that have really, significant disorders or
Yes.
conditions, and I might be their only safe space. But for the most part, most people, I want you to get to a place where you can say, our journey ends here. I am ready. I've got this. That is the
100%.
goal.
You don't need lifelong therapy. They can be episodic for something different that comes up here and there, but not like every day of your life. You want to graduate. You want to
Well,
move.
this is my analogy. Here's my analogy on healing. When people talk about doing the work, I say healing is like washing the dishes,
Hmm.
right? You can finish, but you're never done.
Oh, no.
So, so it's about learning the skill to know how to do that. So you go through an adversity, you go through a challenge, and you learn how to digest it, how to get
Yeah.
through, how to wash those dishes so that you
Yeah.
can have a clean kitchen and you can enjoy some space for
Yeah.
connection, for joy, for
Yeah.
the beauty that life brings. Because if you haven't gotten that cleaned up, then you're always living in a dirty kitchen, right? You never get to experience the joy. But
Ex-
when you're done, it doesn't mean you're done until the next
No.
deal, until the next thing comes in. But you have more space for joy the quicker you get through and clear and understand and digest.
Yes. Exactly. Exactly. You just get to that clean, deep clean, and it's just episodic. You have a meal, you enjoy family, friends, you clean up. You just
You
don't let
clean
it
up
pile
and
up.
then you can relax. Yes.
Relax. House
Yeah.
smells fresh, not rotten. It's
Yeah,
amazing
it's a
how that works.
skill. It's a
Yes,
skill of
it's a
knowing
skill.
yourself and knowing how to clean up.
Yes, I love it. And that's something that we need to understand. I feel like I've said this before. I feel like the mental health community as a whole, though there are parts that have seen the light, needs to
Yeah.
like
Wake
wake up.
up.
They need to
100%
wake
wake
up.
up.
Like it's so backwards. It's so backwards.
I was like, just I like to research stuff or just read stuff like to better understand. And somebody that I had trained had asked me like, why do you continue developing? Like, it's not developing, it's uncovering. Especially what we
Mm,
did here was
yeah.
I wanted to get to the core truth of what is all the gimmicky stuff that can help support but
Yeah.
doesn't necessarily hold the answer. Right?
Yes.
That we need to clear and get back to the basics of what is just part of a human experience
Yeah.
and not pathologize it, not
Oh,
pathologize everything. Like,
yes.
this is a human experience. Oh, well, you're anxious, honey, because you refuse to allow yourself to face the truth
Thank
that you're
you.
holding in there. And
Thank
so
you.
this is a signal from within you saying
Yes.
you need to do something different. But
Yes.
then we pathologize it and medicate it to numb it
Yes.
away until you continue doing the thing and it gets louder.
Yes. And before we went on camera, I was talking about that. Like, um, a lot of things that we call, diagnosis. I'm not saying that there's not some truth to them. I'm
Right.
just using
Right.
depression and anxiety, one that most people have heard
Not
of,
black or
right?
white. Yeah.
We focus on, oh, I have depression, oh, I have anxiety. I'm like, to me, I'm like, through my own personal professional journey, I'm like, no, that's like a like a symptom. Your body is telling you something.
Yes. Yes.
What is causing you to feel that way? What are the factors? It's usually not just one. There's
No,
usually multiple.
multiple.
So
Yes.
differential diagnosis, what's higher, causing the most of the grief, what's secondary, tertiary. Do you know what I mean? Like go
Yes.
nitty gritty in all your systems, whether it's wellness
Yes.
field, is it environmental, psychological, financial, social, like goes physical, like goes through all of those things, get to the now this annoyed somebody once, root cause. Because I said,
Root
like,
cause. There is a
root
root cause.
cause.
Yes.
Someone was offended to me. Another professional, they're like, how can you say root cause, like that minimizes their expertise as a therapist. And I'm like,
Well, why are
no,
we being offended? Like, are you here to help people heal or are you here to like stroke your own ego?
right?
Because that there's a root cause to that too. Like,
Right?
who didn't feel valued, honey? Let's talk about that.
Right? But that's the thing. There's a root cause, right? Otherwise, we're just giving glorified band-aids or just going through sessions and giving it three-letter acronyms
Yes.
and,
Justify. Yeah.
justifying it, but not actually making progress.
We're staying stuck. Those
We're still,
tires are turning
yeah,
and we're
like a
staying
little
stuck trying to move
hamster.
over. Yes, hamster.
Right?
That's not living. That's
Right?
surviving. Yeah.
Right? But then when you start putting the pieces together and then you be still in those uncomfortable moments and work through the discomfort. It's no different than an athlete training. They have to push. There's in life, there's some certain gifts, there's a painful process
Yeah.
before you have the baby or before you have the
Yes.
business or whatever,
Yeah.
whatever it is you have to. Otherwise, you're not gonna get there.
When I tell people, tell me like that there's an analogy because I know we'll hear the people, oh, you're minimizing and you're dismissing the people with severe trauma. Like there are thresholds, right?
Yes.
Even in the medical field. The very thing somebody could come in and be like, look, work out, get buff, just like me. Anyone can do it. Yeah, but his knee is injured. So if you have an injured knee, you have to repair that before you get there. Or
Yeah,
they've got 37 broken bones. Now you need to be in a full body cast before you
exactly.
get to the rehabilitation, depending on where you are. But here's the thing, even the person in the full body cast has to get up at some point. It can't
Exactly.
be forever. At some point, if that thing that helps you at some point begins
No.
harming you when your muscles
Yes. Your muscles will
after you pass
atrophy, like waste
after you
away.
pass the
Like,
threshold. Yes.
yeah, exactly. That one thing that
Same
used
thing.
to help you can,
Same thing in mental health,
yes,
right? Yes, if you're there, then let's start with the cast. Let's start with that. But at some point, you got to start rehab. At some
yes,
point, you've got to move back towards what your capacity for functioning is.
yes,
That's where we do wrong, is because we tend to go one extreme or the other.
yes,
It's all or nothing, and it needs to be individualized. So some people with depression, yeah, they go there and they might need a different treatment than this other person. But I'm with you. The majority of people, anxiety, like any of those symptoms, there's a trauma that you've been suppressing. There's a truth
yes,
you've been denying. There's something that you're terrified of moving forward.
100%. 100%. And that is what I see in my clinical practice as a family physician. And even when I talk to my coaching clients, like there's something there. And I'll go even a step further because again, this, like, I often find there was a dysfunction in a critical relationship in your life. That,
So our whole theory behind CMI, critical memory integration,
yeah.
is we have early life experience or earlier experiences that led to an adaptive response that made sense at that time, but
Uh-huh.
has now become a problem because it's an outdated policy procedure manual that your brain
Yeah.
is on how to survive. And
Yeah.
out of context, it becomes dysfunctional.
Girl, there you go. I didn't study your work before I had this conversation with you because I keep it fresh. But that's exactly what my theory is.
Yeah, yes. This we call those critical memories, and it's not always a trauma. This
No,
is
it
where we
doesn't
go
have to
wrong
be.
too. ACEs scores. I'm sorry, honey, but it could have been like me in kindergarten. This kid sat next to me and we only spoke Spanish and he didn't know his last name and I thought he was dumb. So I figured I was dumb too. And it destroyed my academic achievement. Like,
Exactly. It doesn't
failed.
always have to be trauma. Doesn't
Not
like
always
as in
trauma.
how we see it, right? Yes.
Yes, it impacted how the understanding you had of the world, of yourself, of relationships, of
Yes.
love, of value. All of
Yes.
those things get shaped by experiences.
Yes. Yes.
Sometimes it's traumatic, not always, but
Not
this is
always.
why we go wrong because we're looking for the obvious.
Big one.
That's not how the brain works.
And sometimes it's not, like I said, it's not the big one. It's sometimes us even not acknowledging who we are as a person or putting ourselves down. That's those
That's the
quiet
biggest
situations,
one.
right?
I would say almost every disorder is an issue of disconnection from the self.
Yes. Yes, exactly. There's a disconnect because again, there's a study that came out recently. the Harvard study on happiness, the
Yes.
85-year longitudinal study showing that the greatest predictor of the healthy life is not status, like IQ or money. It's the quality of our relationships. And again, that goes down to connection, the feeling
Yeah.
of love, safety, belonging, which are our
Yes.
birthright when we're born. But for
Yes.
some of us, the disconnect happens seconds after being brought into this world,
Yes.
some years later. But the point is, there's a disconnection, there's a repeat
Yes.
disconnection. And that sets the framework for the way we see, view life, and we see through life through that lens. And that
And
becomes,
the problem,
yeah, go ahead.
yep, the problem is exacerbated by the fact that we're taught to look outside of ourselves for answers.
Yes.
That we look at how someone else did it. Honey, that's the
Yeah.
map to her house, not yours. So yeah,
Yeah.
you're gonna get lost. Like
Yes.
you have to figure that out. And it comes from inside of you, which means
Yeah.
you have to be connected to you and follow
Yes.
the signals that your body's giving you because it's telling you where the problem is.
Yes. And that is why our most critical relationship is the one we have with ourselves. And
Here,
most
it
people are
starts here.
here. They're too scared to look at themselves. They don't like to
Yes.
be in silence. They don't like to look in the mirror. They don't like it. They like the noise and distraction. That's the big problem.
Yes, it's, when people say, well, I care about everyone else except for myself. That's not
No.
compassion, that's pity.
Mm-mm.
That's compassion without integrity. And if you don't have integrity, what is integrity? That means you've been integrated,
Hmm.
connection. It
Hmm.
has to start from within you so it can flow out freely.
Yes.
Because if you go, I'm here and I skip me and then I generate it out here,
Mm-mm.
what happens in this space? That is the space where the resentment begins to grow. It is fertile ground
Yes.
for the saltiness of expectation and
Hmm.
disappointment and
Yes.
blindness, right? Because someone looks like they could feel me here, and then you miss all the other things
Hmm.
that they have in their humanity. And we end up in relationships we thought were ideal that are not. We end
Hmm.
up in situations that we're like, how do I find myself here again?
Hmm.
Because you're not caring for you or getting to know you first.
Hmm.
Clear those glasses so you could see clear.
Clear those glasses, clear those lens. Charity begins at home. You got to start within. But wow, this is amazing. Like this, our views are like basically identical. We
I
just have,
call I call it universal truth. If
yes.
that makes sense, and you hit truth because you feel it.
Oh, I feel it.
Yeah,
I
feel
feel
it.
it. Like is and each time I get to test my feelings in an office exam visit with a patient, and it's like I hit the jackpot in like minutes. Bing with them. Oh, that happened. Oh, this. Oh, okay. Oh, they didn't know. Like the connection. How bing, 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 bing. It didn't take hours and days and months of
You
reaching.
gotta be attuned.
No,
Yeah, you
it
tune in.
was just there. And they're like, wow. And I'm like, let's sit on this. Okay. And then I'm thinking to myself, now, how am I going to find someone else to continue this conversation with them who has the same? There's only so much I
Well,
can
you
do.
send them to a CMI clinician now. That's what you
Well,
do.
because now I know, right? Because that's the challenge. When you've done the work with a patient, you've got to the root cause, and that bristles some people's feelings. That's their problem, not mine. Um, um, you don't want to send them back to just talk
No,
therapy.
no. And that is the thing is like we lean on experience,
Mm-hmm.
right? Experience is what matters. And you can have an experience within yourself, and I have no idea what experience you're having, right?
Yes,
So none of my business. You can share it with me if you want, but I don't need to know those details to guide you through the experience,
exactly.
right? You need to know you. You
Yes.
need to know how to connect with you and how to be with you. And that's all I'm going to teach you is be with you. And the dark places, I'll hold your hand while we go there. But once you've gone there once, the second time you might be like, I got this now. And you start doing work on your own at home. That's when people take off.
Yes. We want to transform lives, right? We want them to be like not just walk, run. Like
Run. Yeah, when
run.
people say like, oh, I look up to you. No, look up to you. You've got the
Yes.
same thing I do.
Yes.
You're seeing in me what you have in you. And my job is to show you how to find it within you.
That inner greatness, that seeds of greatness, that ability to heal, to self-soothe, to learn, to thrive, to grow, right?
Yes.
That doesn't
Yeah.
sound like we're not trying to raise people to be dependent on us. No.
Ooh.
We're just instruments to guide you. It's in there. We're
Yeah.
gonna help you with some prompts, maybe
Yes.
encouragement, but it's
Yeah.
within each of us.
Yes.
And that's the beauty.
That's the beauty. It's everything. That's how
Right.
people, oh yeah, that, yeah, yeah, keep going. Yes, it gets very, very ugly there. That's that. Oh yeah, fear, it's just trying to warn you. Keep going. You're good.
Yes.
Let's go.
Yes, exactly. And fears, again, it could just be your body trying to warn you, or your body just trying to keep itself, quote unquote, safe. But behind that
You
fear,
know,
there's there's like good things. There,
yeah, I call it phantom pain, Tommy, because if it's not here now, then it's disembodied. That means it's old.
there you go.
Doesn't
Phantom
match
pain.
right here. You're having a panic attack, but you're in a safe place. That means it's phantom pain. Let's
I
go
love
figure
it.
out what do you do? You have to use the mirror, right? So the brain can catch up with
Yeah.
reality in the now that not lo that no longer is a
Yeah.
threat. That's all we're
Yes.
doing. Catch it up. Update
Yes.
those neural networks.
Call it out. And we're calling it out. We're not hiding, right? We're not going to be like, oh, that's uncomfortable. Okay, we just won't talk about those things like ever because it makes you feel uncomfortable.
Those are the best things. Those are the
Exactly.
ones that hold the most data for
Truth.
gold mines.
Yes. And if we could just, if, it's like those who are listening, don't run away from fear. Don't run
Stop
away from
running.
pain. It's a signal. And at that time, your body's not even just whispering, it's screaming at
It's
you.
screaming at, and it'll
It
keep
is like,
screaming all to your
no,
deathbed.
like, listen to
Yes.
me.
Yes.
But
And
for
it only
some,
gets harder. It gets harder to silence it. If you don't learn to tune in, it
oh,
only gets harder because life gets more complicated as you get older.
exactly, life gets more complicated. And if we're not careful, sometimes the body will eventually shut down. It will
Oh,
say,
man, you know, the first time I saw that whole like Eric Erickson model of development, and I like to like fast forward to the end of the book, and
mm-hmm,
it was two options, you know, ego integrity versus despair. And I was like, how do I avoid that?
mm-hmm,
What do I need to do here so that I can go left and not right?
mm-hmm,
The work
definitely.
starts now. You have to start connecting with you, accepting you, understanding you, embracing you, growing bigger than what you've experienced. Don't get rid of it.
Yes.
You get bigger than it.
Yes, grown bigger than what you've experienced. So if someone's listening and they're like, okay, I hear you. What are some things that they can do even right now?
Even right now, start getting curious. You know, one of the things that I tell people, I call it, I wish I could like market this and get you some Lumify drops, you know, those ones that take the red out, a
Mm-hmm.
big, you know, box of tissues, get you a sad movie and go have a good cry.
Yes.
Have a good cry. If you can't force it, then go find something that'll elicit it, but just let it out.
Yeah.
Stop being so afraid of falling apart because the only thing that precedes a breakthrough is a breakdown. You
Oh,
have
yeah.
to go through that. Has to be
Yeah.
broken down to have a breakthrough. So
Yeah.
start like feel your feelings, be curious about it. The things that you're running away from, turn on a flashlight, look at it,
Mm-hmm.
explore it. And if it's too big, then go find someone to sit with you.
Yes.
Therapist comes in. But start,
Exactly.
give you a timer if you need to. I tell people if you're too scared that you know you're going to lose this too long, then put a timer on for 30 minutes. So you could have a 30-minute cry and then you can do your whole suppression and whatever you do to control it. I
Mm,
promise you, the moment you move towards it, it moves faster.
definitely. That's so true. That is so true. Like it's you just got to do the work. And you know what? Speaking of the work, you you talk about critical memory integration. We mentioned that in your
Yeah.
bio. Maybe
Yeah.
let's bring our listeners back to the basics. Like, what is that, and what are some?
What is
Yeah.
that? Oh, it's the answer to what you've been looking for. I'm telling you,
Yes.
everything that you're talking my language. It is a way for us to rediscover that connection with ourselves,
Mm,
to integrate, to own our journey,
mm,
to recognize that we are not the experience, rather the experiencer. And
mm.
from that angle, we have agency, we have
Yes.
control, right? A lot of people offer you options on who you're going to be and what your limitations. I
Yeah.
want to teach you how to decline those politely,
Yes.
if you so choose. You don't have
Mm-hmm.
to embrace it. You can decide that. And all this is doing is a process of helping you reconnect to
Mm,
that core, which is
mm.
what we call that authentic self, where you hold your agency. It's there, it's been there. That's where the signal is coming from. It's telling you this thing that we're doing, It's not really who we are. We kind of picked that up back in 92. You know, that thing that happened and we had to survive and that it like helped us back then, but it's kind of outdated now.
Mm-hmm.
So let's work on that. But you
Mm-hmm.
have to be willing to explore it and connect to it in order to be able to transform it.
100%.
Yeah. So it's
So,
a
yeah.
process that you go through. If you
Mhm.
come into my office and I ask you what's showing up for you, and you tell me I keep finding myself in this pattern,
Yeah.
or I just act a little extra, I get really pissed off in these
Yeah.
situations, what you call triggers,
Yeah.
whatever it is, and I help and I guide you through exploring of it, of connecting internally. It's an internal journey to find the answers. And the process has been just absolutely transformational in my practice because the people that come to see me, I'm like, I don't know you, like I don't know what's best for you. I give bad answers, like I give snarky answers, like I don't give advice. I know what I need to do in my life, but I've never been you and I don't know all the factors. But what I can do is teach you to trust yourself.
Yes.
It means you have
Yeah.
to know yourself.
That is
So
so beautiful. You get
yeah,
back in the driver's seat. You thought you were in the
back in the
driver's
driver's
seat,
seat.
but you weren't.
Yeah.
You were like backseat driver at best.
And
You
you
were,
didn't even know.
you didn't even know. Exactly. You didn't even know. So
Yeah.
let's get you back. And one thing I often hear in my practice is that patients who have actually tried therapy, some have, some haven't, they've said that it didn't really work, but it was like wasn't until we tried a different approach before we
Yes.
had a breakthrough, because for many trauma survivors with a big T or little t, it doesn't
Mhm.
really reach the root of what's driving their reactions. You know what I mean? Like we use these terms under root cause, like,
Yeah, but do you know why? Because so many of our, number one, so many of our approaches, and I don't want to like at all diminish the value of them,
of
but so
course.
many of our approaches make assumptions.
Mm,
Let's take trauma, for example,
yes.
pathologizing an event. You could have something that meets this criteria, but not the symptoms. And you
Yes.
could have another thing that happens and all the symptoms are there, but doesn't meet this criteria.
Mm-hmm.
Why? Because it's not about the event itself. It's what's going on inside of you, the disconnection within you.
Yes.
That's the one first thing. The second thing is that we try to fit old people into one size.
Mm-hmm.
So here's the modality, and this is what research says works. But guess what? That research took a homogeneous population and
Thank
studied it
you.
on that.
Thank you.
So if I'm looking at, we're doing like psychedelic studies right now, and there's out of like it could be 35 people that walk through and only one makes it through to the actual dosing. And I'm
Mm,
thinking, yeah, you do this in psychology, like, and you have this specific and you say it works. Yeah, for that one out of 35, but what
yeah,
about the other
exactly.
34 when they walk into my office? How do I know that the thing that helps this one isn't going to hurt that one? So
Exactly.
that's another problem, right? And then the worst thing is that number one, we assume things based off of what does work. So, for example, we use memory reconsolidation, which is a basic, just the brain's way of like updating information, right? The memory networks. Anything something's activated, it's susceptible to change. There's a lot of approaches that do that, but some assume that the issue is your belief, the cognition, right?
Hmm.
Some assume that it's an image. Some assume that it's a somatic response. Some assume that it's your perception of parts of yourself that you have not integrated. And
Hmm.
they all use different language and they all have a similar pattern, but they miss the other. And this one misses that one, and this one misses that one. And it makes an assumption. So let's say you're looking for a cognition, but this is pre-verbal trauma. This is a
Hmm.
pre-verbal, you're not going to remember what you thought like back then,
No.
or you're not going to have an explicit memory. It's going to be implicit. It's
Hmm.
a felt sense. Well, our theory is if you learn to tune into the signal, it'll manifest and it'll show you what is needed. It might manifest as a scene, an episodic memory. It might manifest as a metaphor. It might just be a felt sense. But how we know that something shifted is because the person's response, there's a moment, this moment of connection that happens. There's this like aha,
Yep.
this awareness
Yes.
of, wait a minute, that's not true, right? I am loved, or I am worthy, and we don't have to convince them. The experience has to happen from within because you cannot convince your nervous system of something that it's wired to do to survive.
Exactly.
And that's the problem with the talk therapy, right? We're trying to outcompete these adaptive responses and we lose. We lose because the body calls BS on it. I
Exactly.
lose myself. No, you don't. I'm worthy. No, you're not. You see all of these? I have this data to prove. So until you have new experiences, we call that the library of experience, to add to it. Now there's different reference points. And that's the angle from which we work with that. And like we said earlier, it could be critical memories because it's experiences. It could be traumatic or not traumatic,
Exactly.
but they are vital in shaping your worldview, your understanding of connection, of relationships, of all of those things.
Exactly. I love it. S- I can only imagine the heads that were rolling when this came out, especially in the psychology world. Like this goes so against the traditional modalities that you see and you hear about, but
Yeah.
it just sings so true to what I have experienced in
Ah.
my own practice
Well, here's the
personally.
shock. Yeah, the shock is like, we haven't yet because we developed this. We just launched training last January.
Wow.
And for the most part, most people say there's nothing that you're saying that doesn't feel true,
Ah.
right? People who have experienced, they recognize where we do get resistance, a lot of resistance, is a lot of practitioners want to facilitate the process instead of like be with the process. So those
Ah.
are the ones that want to be the rescuers. They want to
Mm.
have the answer. You don't have the answer. Like they
No.
have the answer within them. That's where the challenge is that we want to be experts. We want to
Mm.
be the ones to help do something to make
Mm-mm.
it feel better. That's
Mm-mm.
about us.
That's ego driven. In the marketing world, when I was learning about it, I read this book. It's called Brand Story, I believe, and it's about making the consumer who's coming to your website, whatever, the hero. Like they
Yes,
have the power within themselves. It's
yes.
just you're kind of helping facilitate.
Yeah, you're just a mentor.
Your
Yeah,
support. You're
you're a
not the
mentor.
hero. Like, but so many people say, "Oh, we're the best. We have 20 years of experience here. We have won all these awards. Me." But that's not what people need.
That's not
They-
what they need, and it doesn't. I had a colleague like that. I said, nobody walks into your office hoping that your academic accolades heals them.
Thank you.
Like they need to, and I heard this from a speaker once. It just really hit me where she said, when I was facing my fear of like public speaking, it's
Yes.
not about you. She said those people in the audience will never have to look at you. They have to look at themselves in the mirror. So
Mm,
what's important is as a result of their interaction with me, do they look at themselves differently? Do they see
yeah.
themselves differently? That's how you make a change. I don't care if you remember my name or what I said,
Mm,
but if you feel differently and you see yourself differently and you embrace yourself more wholly
yeah.
as a result of my interaction with
And
you,
that's
then that's
priceless.
when
Yes, I agree, girl. I agree. And
that is
and because it's like a duty for them. It's not about you. It's like I'm just gonna do this. You know what? I'm gonna give you when you're on the stage, do your best, give your best shot, give your
good.
heart, give your truth, and leave
That's
it.
all you can do.
All you
And
can
so
do.
that's people when they suffer from like, imposter syndrome, because you're being an imposter, that's why.
Hmm.
So be authentic, love yourself, embrace yourself, all of your shortcomings. Because if I come to you and I know I accept fully me, I am human. I'm not going to expect myself to work a miracle with you.
Exactly.
And it's in that space, only in that space, that miracles actually happen.
100%. Yeah.
Because I don't need to facilitate anything. I'm whole as I am, and I'm
Hmm.
going to help you be whole as you are, and
Hmm.
that's it.
Yes. That's so beautiful. I like. I'm so proud of the work you guys are doing. It's so.
I'm proud of the work you're doing too. I'm like,
Thank you.
especially in the medical field, you have an uphill battle, girl. Like,
Yeah. Yeah. It
because
kind
I see, boy, especially with the specialties, I got this one, like the oncologist wants this, but the cardiologist says no because you'll die of a heart attack, but at least you won't die of cancer. So and it's like this battle. I'm like, do y'all know it's a human being?
exactly. And that's where
Why
the
are y'all
family,
battling?
as a family doctor, it's like people say the quarterback. You're like, we just look at the bigger picture.
The
I'm like,
same
okay,
team.
I'll be the orchestra.
Still lose the game. Yeah.
Right? It's like, okay, it's like, yo, chill. I get it. He's these kidneys, but he needs to live to see those kidneys. So let's stabilize this and let's do this and let's do
Work
this.
together to figure out what's best for the entire system.
Yes, a holistic approach to. wellness, to health, right? That's
Complete.
the beautiful thing. And mind, body, spirit all together, past experience, lived experience, generational experience, intersectionality, all of those things.
All of it
It
matters.
matters. It matters. It's funny. I remember someone introduced me to this psychiatrist who was coming by this office, and I was like, "Oh, nice to meet you." And I was just talking about like, you know, my approach to mental health and like, what do you do about um, how do you deal with trauma or ACE scores? I don't know what I was talking about, but anyway,
Mhm,
it was a
mhm.
blank stare. It was just like he just talked about SSRIs or something, and I'm just like, I have no idea. But it's just you
I
just find your people, and if you have to make
do.
what you do, you just make your own table. I have discovered in life that sometimes you just have to make your own table and
Yes.
with as much energy and vigor, and eventually people
Yes.
will come and want to eat at your table. Because if you
Yeah.
try to sit at their table with their policies that is totally, completely 180 from what you've seen as the truth, you're just gonna go make yourself sick every day being there. You'll vomit.
I tell people, man, my world did not have room for the APA. Like it
Oh
was a
no.
hot mess, with the language and the wrong words and the wrong things and the mismatched everything. Like,
Mm-hmm.
okay with that. I'm okay with that.
I'm okay
So
with that too.
I find my people, and in that I find wholeness, and that's all that matters.
Exactly. And you know what? We're living our truth and living our happiness. That's the thing. Like you were saying that, you're healthier and stronger and all these other things. And that didn't happen out of a vacuum. Same with me. Patients would like, they were like, Dr. Mitchell, you look so good. Like, you look so young. Like, you lost all this weight, this, this. And, when you have family practice, you see them lots. So it's like they get to,
Yes, yes,
they're
I
like,
see that. Yeah.
please, I'm mama better than my cups. That's what I tell them. They're like 60. I'll be like, I'm your mama, just so you know.
Just so you know, don't get this good skin mixed
Yeah,
up.
it wasn't by
You better
accident.
know.
This wasn't by accident. So if we a year from now, you could be a whole new person. You game, but
Yep.
like a scale of 1 to 10. 10 being like you all in. Where are you? And I'm like, is there anything less than 8? I'm like, I'm just gonna annoy the hell out of you, just so you know, because you're not ready.
Joking.
My
Yep.
enthusiasm. But we worked. But most of them are like, yeah, let's do this. Because they're seeing it and they're thriving and they're dealing with the root cause. And I say that because people don't like.
Yes, I love that you're embracing it now. Don't let nobody take that truth from
No,
you.
I can't because I
Every
can't.
tree has a root. Just because you can't see it, don't
Every
mean it's
tree
not
has a
there.
root. Every tree. I love it.
Like most people come out here, they take an apple tree, they like take them off and staple oranges. I'm like, you didn't. It's not sustainable. You have to get to the root.
Stick to the root. Every tree has a root, and you want to be planted and rooted. And in my business, is one of the logo I use in all three of them is the bonsai tree because it's very articulate, it's very curated, it's very structured, it's rooted. It's like a symbolism to it. It didn't happen by accident, and that's like life and health. It's not accidental because the way the world is, I think it's the what's that theory of what's that entropy, whatever the hell it was, can't remember. Whatever. The world is chaotic. Like that's
Oh
just
yeah, yeah, yeah. Yeah.
yeah, right? But you can
Control chaos.
you can control chaos. Exactly. Organize chaos. That's why I like to organize the chaos. Doesn't mean that things aren't here and there, but it's just a system, the flow.
Yes.
And I like it. It's just
Yes. You
it's just
move in the direction with it.
with
Don't
it.
fight it.
Yeah, you just go with the flow. But you have
Yes.
systems in place and you recognize, oh, okay, this is happening in the environment. This is a sign to kind of tilt here a little. Oh, the clouds are a little gray. Oh, maybe I should go come inside. Or, oh, this, like, you just start learning your environment. You get learning your feelings. Oh, I felt this person's energy made me feel, oh, I felt this way or whatever. What is that? Like, just, you just keep on moving, rolling, being happy, talking, knowing that you can heal, knowing that. Pain, it should not be avoided. Difficult conversation. That's another thing. People like to avoid difficult conversation because it's uncomfortable. Oh, it's TMI.
That
Ooh.
means it's worth it.
Exactly.
If it's not uncomfortable, it's probably not a serious conversation. Then it's
Thank you.
just leisure, that's fine.
Exactly.
When you want to
Exactly.
get some serious stuff done, you need to have the capacity to have serious conversations.
100%.
Yeah.
100%. And that is the truth, but people like to run away from them. Oh, it's uncomfortable. Something happens in the world. It's our thoughts and prayers are with you, but that's as far as
I
we.
tell people if it's comfortable, that means you're going in circles, honey.
Mm-hmm.
Like it's too familiar to you,
Mm-hmm.
right? And so you want to live your life in circles. More power to you. I don't get offended by those people. I let them be, but
Mm-hmm.
just don't get in my way.
Mm-mm.
I keep doing your circles, but it's uncomfortable. That means that you're no longer going in circles. That means you're stepping into
Next
growth,
level
next
growth,
level. Yes.
right?
And
That's
that's what life is about.
the growth. You gotta prune it. You gotta feel it. It can be a guide. Like if you're making a goal in life, if it doesn't make you feel uncomfortable or feel a little like, oh, can I do that? It's not
Yes.
really much of anything. You're not challenging yourself for growth.
Yes. And it's so when you numb something, you numb the pain, you also numb the joy.
Thank you.
So this client who told me she's had left numbness on her left side to the point where she couldn't wear her ring because she couldn't feel it. She could
Mm,
grab things, but she couldn't feel anything. And she
mm,
said, none of my doctors can figure out what's going on. There's no like medical rationale. And I
mm,
really feel it has to do with stress. I'm like, well, possibly.
mhm,
I don't know. I'm not a medical doctor and I don't have anything to measure. But she was seeing her neurologist.
mm,
And we did her intake 2 weeks ago, did one session last week, and she was telling me just by moving towards discomfort. Because I said, well, if you're disconnected from your body's letting you know, oh, you don't want to feel? Well, let's numb it out. So you got to start moving towards. And
mhm,
she did. And last week she's like, I'm starting to feel in my hand again. And then we did some CMI, connected some memories, and that was her assignment. Keep moving towards it, keep moving towards it. And she came in yesterday like crying, just said, Steph, my hand is back. I cleaned
mm,
my fridge. I cleaned my fridge. Do you understand how big that is? And I'm
mm,
wearing my ring.
mm.
And I don't think my neurologist will understand because he thinks we still need to do the MRI, which I think she should anyway.
Yeah, for
But
sure,
she's
cross solid.
whatever, yeah, just cross it off. But she's like, but I
Mm,
know this is what it was.
mhm.
And it's now the symptoms are gone. But how do you tell him I don't want to hurt his feelings? Like just
It's not about him. Just say it.
but I'm like, you never know. These things are all
They
connected, and
are.
your body's listening, and you tell it to numb out, it's going to numb out.
Hmm. Our
It's gonna
body is
disconnect.
listening. Our body keeps score. When I listened to that book on Audible, that opened up my eyes a lot.
Oh, and I know that there's like other work that says, no, it's in the brain. Well, the brain interprets. But
Hmm.
I'm like, too, is like the memories are all over because if you didn't have data that gets transmitted, then how do you explain those situations where someone gets a liver transplant or another organ and they have memories that were not theirs?
Exactly.
Like, these
In our
things
cells.
happen.
It's amazing.
So much we don't know yet. So
There's
much to yet be discovered.
it is, but I mean, people like you and the are gonna find it, and the people that you work with, like it's just staying open. Like knowledge
You
is
have to.
we
You
have to
have to
stay
stay open.
open. We have to. Like, that's how growth happens. Otherwise, we'll be thinking the world is flat and there'll be no one will fly anywhere and there'll be no person on the moon. And
Hmm.
like it's just staying open.
It's like Neil deGrasse Tyson is one of my favorite quotes about how the greatest challenge of the human experience is to know enough to think you're right, but
Hmm.
not enough to know you're wrong.
Mm.
It's
Yes.
you think you're right and then you live that as gospel and you miss the
So
truth.
much. So much. Exactly. And you know what? The truth could be you like it's not covering a painting on the wall. You uncover the first corner, like, oh, look at this beautiful painting. Oh, it's this. And then they move a little bit more. It's like, oh, okay. It's like it's an uncovery. And that's what we're on. Like maybe 5 years from now there'll be CMI 2.0. Like it'll be even more, but it'll be built on a strong foundation of
Well, it's a
connect.
foundation of expansion. That's all it is, expansion. And
Yes.
and expansion, if that is the core of it, it's infinite. You're
Yes.
always expanding. So it's like the hero's journey is kind of what we based off of. I
Yes.
don't know if you've heard of the hero's journey, but
Yes.
you are the hero in your story, and every journey that you
Yes.
have brings you to new awareness, new
Yes.
understanding, and preparedness for the
Exactly.
next layer, and you continue growing, continue
Yeah,
expanding.
exactly. And it might seem mind-boggling to think that way, but it's like life is infinite, love is infinite. Like it's infinite. Like it's hard for our human brains to imagine, but
Grasp it, yeah.
it's just what it is. And that's why you can be lifelong learners, and that's why I don't believe in impossible. I believe any anything is possible.
You
It's
just keep
just
going in that
keep
direction.
on going. Healing, transformation, living in a world where things that used to trigger you don't have to trigger you, where you could talk about experiences without sorrow because you found the power that experience gave you. And that's another conversation entirely, I
Oh,
think.
that's a whole nother. They might not be ready for that.
No,
It's like
that's
you want to
ninja
really
level.
you want to transform the world, you have to learn how to understand the most distance of your enemies. When
Mm-hmm.
you can embrace them, when you can expand to include all of it,
Mm-hmm.
now you will know how to connect and how to transform. Anyone
Mm-hmm.
who's made a difference, I always tell my clients, the ones who struggle with that, I don't know if you've ever seen Best of Enemies,
Mm-mm.
but oh my gosh, it's one of my favorite movies. But this woman who transformed, she had to work with, she's a black woman and had to work with the KKK,
Oh,
like
oh Lord, have mercy.
yes.
Mm-hmm.
Oh, it's a tearjerker, trust me, because you
Mm-hmm.
get pissed off, but I'm telling you, by the end, you understand differently.
Mm-hmm.
Because that woman had integrity.
Mm.
Integrity is where no matter what the circumstance, is a difference between a sponge that gets dictated by its environment and a solid metal ball that disperses the environment around it.
Mm.
Will not change me. You will not dictate who I am, no
Mm.
matter what you bring to the table.
Mm.
That strength. And she transformed that man. Like, whew. There's another one, accidental courtesy too. Daryl Davis. I think he had like how many, like 68 or 70 grand wizards hand over their garb to him
Mm.
because it transforms their lives. You
Wow.
can't do that if you're not solid in who you are.
Oh yeah. You gotta exactly.
You can do that if you're offended every time somebody's different or
Oh, I
doesn't
know, right?
do or challenges the beliefs that you've held so deep
Mm.
for so
Oh,
long.
I know. I feel you. The world is not many people are not ready for that one. But hey, doesn't matter. You can always listen to it later. We should do a
Yeah,
part two.
you can
This
pause. We'll see you later.
yeah, this is very good. Wow. I enjoyed this conversation. I like the work you're doing, amazing. I 100% agree.
We're bridges. We're
Yeah,
bridges.
we're
Yeah,
bridges.
shaking it up.
Yes, just changing, transforming. And if the institutions of the world, the APAs, AMAs, whatever, don't necessarily align, that's their choice. Over time, who knows?
We've done a pretty good job. I got a colleague that does all the research and he brings it. It's just about what research you are looking for. Because there's
Mm,
so much data out there, but people haven't put the puzzles together to make
hmm
sense of a lot of this because we limit our reach. I'm like, we have to look beyond just psychology. We have to look at what have we learned in the neuroscience? What have we learned in quantum physics? What have we
hmm
learned about truth of the world and individuals and how we work and how we function? And
hmm
we're here, we're so limited into like, here's my specialty, therefore this is the truth, and you
Nah,
miss the rest
it's
of the
bigger
country.
than that. And that's the nice thing about being a family physician. I kind of changed the phrase. Jack of all trades, master of none.
None,
Well,
yeah,
I say
yeah.
master of some because you really can work on your knowledge gathering experience. You don't have to stay surface level. And when you go deeper, you see the connections that you might not see if you just at the top. Like look under our ground, there's so many connections, there's pipes, there's fiber optics, there's so much
Yeah.
that we don't see. And then stuff that's invisible too.
And I
Like
tell people you only need to be a master of this one.
uno, yourself, the most important person, yourself.
Master of one, this one. If I can master me, I can then be a jack of all trades. I can do whatever you become
Yeah.
open because you're not going hungry, you're going with curiosity, and that's how you discover. And that's
And
how you
there's basic human principles that are universal. And once you understand those things, wow, it just takes away so much of the guesswork.
Yep,
It's like what
yep.
there's
Does
just
this align with that? No? Okay, then maybe it's one way of doing things, but it's not the only way.
yeah.
Yeah.
It's so beautiful. And it just brings me so much joy and it just puts a smile and makes my smile lines even more prominent. Yeah.
Mine too. But it's worth it because I'm like, we're
Right?
doing the
You
same
have this,
work.
yeah. It's so
We're the
worth it.
same thing. We're seeing the same thing and we're moving the same direction. And it's the synergy.
Yes.
You see others, and I think when there's enough of us, speak up. If you hear us and this feels true to you, speak up.
Speak
Be
up, share
courageous.
it. Share it.
Share it. And if you
Advocate.
need to find someone like me or tell me to like hide behind, come on.
Yes.
Join our
Yes.
team. Like, come join us, support us. We will, like, there's strength in numbers, but there has to be a challenge. There has to be a
Definitely.
we,
And for
we're on.
and if our listeners want to reach you, what's the best way to reach you since you mentioned find us?
Yeah, arisealliance.org. That's our
Okay.
website. Estefana at arisealliance.org is my email. We're doing the work everywhere, everywhere. We're in the fields. We've had psychiatrists, that are trained in CMI. We've done programs for uh, child workers, people who work with kids with trauma. We did
Mm,
one for the police department. I'm doing one for the city of Chandler for a community that's
mm,
open to the community, that's just teaching them about, the basics of being human, like your nervous system, your memories and
yeah.
mood, and what is this for. So I'm super excited about all the work that we're doing, but it's people like you. It's, the listeners that see it and know there's truth, and then support however way, whether it's raising awareness, whether it's, sharing the podcast, any of that. I mean, there's strength in numbers.
There's definitely strength in numbers, and we'll continue to grow those numbers as
Yes.
the podcast is becoming more and more well known. It's been going for 4 years, and also we'll share it on all our social medias. Like I'm huge big on LinkedIn, and LinkedIn is amazing. I've met so many amazing people there who who find
Are
their
doing it.
who find their voice. Who are like, oh, I believe that too, even though the institution
Yeah.
doesn't. Oh yeah, I do.
Yeah.
You know?
That's what I'm saying. When we speak up and other people are like, "Oh, I'm not the only one."
Yeah, I know.
No, you're not.
You're not. We
There's
just
way
say that
more of
quiet
us.
part out loud. Eh? It's like, and from cultural
Yes.
upbringing, no one sugarcoated those things to me. There was no gentle nothing.
No,
It
I
was
tell people
like
we're savages. We're savages.
savage.
So I tell people that's why I sucked at being American, because Mexicans, we call each other by what you look like. It's so inappropriate in America. So like, hey fatty, hey skinny, hey, it's so cool. Like, if they don't call you by what you look like or like some pet name, then they don't love
Love
you.
you.
That was such a mind, like, oh, people are offended. Like, but that means I love you. Like, what? I call you by your real government name. That's weird. Like, who does that? Means you
That's a,
don't
like
like me.
that's how it is in a lot of the world, just so you know. A lot of
Hey,
the world outside this thing called North America, well, Mexico was, it's like
Mexico's a whole different level of savage too sometimes. And I'm like, oh, that's why I seem like I'm dysfunctional, because I don't fit here, but I'm all right. I'm good with who I am. Like, I'm fine. I enjoy it.
Yeah, that's true. I was not called by my first name. I was called Fatty Bum Bum.
In a very loving way, probably. Yeah. Yeah. People would be so offended. I'm just like, I had a friend that was really chunky. They called her esqueleto, skeleton. And it was like, they just call people by that. It's not, I don't know. It's hard. This whole cultural thing is hard.
I know, right? Trying to
That I'm like,
politically
I'm sorry if
correct.
your feelings are hurt, but hey, don't tell me how to process my trauma. Like, it's just how it is. We're speaking truth.
Thanks for being on the show.
It's your
I
show. Yes. Thank you
I
for
know.
great. This good
And
conversation.
thank you to our listeners for listening and sharing your most precious resource, your time. And we mean it. Share this message. Like, honestly, I feel like healthcare wellness is there's gonna be a revolution. There's gonna be a change
There is a
in
revolution.
our
Yeah.
lifetime. Like,
Yes.
in our lifetime.
Happening right now. It's
It is
happening.
happening right now. People are just seeing the truth, and you can't unsee it once you've seen it. So you heard it. So now it's just a matter of connecting with yourself and finding
Yes.
the right people to talk to so you don't stay going in circles and circles
They
and circles.
stuck.
Yeah.
Yeah.
You gotta
Awesome.
talk. Thank you, my dear, for being on the show. And listeners, again, thank you again. I know the show is a little longer than we normally go, but we were just having a good conversation. You can always come back and revisit parts that really got your attention. Till next time, this is your host, Dr. Tommy Mitchell from the Mental Health and Wellness Show. Bye.